Welcome to our presentation on providing effective lactation support and consultation in neonatal intensive care units. Katrina, Debbie, and I focused on how we can enhance lactation support for NICU families. In a push to provide quality care to the newborn, a mother's pumping or breastfeeding lactation journey fails to become a priority. A mother should be encouraged to provide her own milk, and helping her be successful long term should be an integral focus of a NICU infant's care plan. We reviewed how staffing shortages and lack of follow up by staff contributes to infants not receiving mother's own milk. However, many hospitals are developing, improving, and implementing new methods to provide quality and holistic lactation support. By using multidisciplinary approaches, facilities can use visual aids, technology, and continued education for staff to support caregivers. More facilities will be able to identify, connect, and follow through with families who wish to breastfeed and pump for their NICU baby.
Some health benefits of breast milk can include reducing the risk to the newborn for sepsis and necrotizing enterocolitis. It can also help develop a healthy gut microbiome and a healthy immune system. Inadequate support results in nutrition deficiencies for the newborn. Without support, mothers and infants may struggle to form a healthy bond, and newborns may experience a developmental delay due to poor nutrition.
Patient population most affected are newborns in need of critical care, such as stabilization of airway, breathing, or circulation. Because critical care becomes the priority for these patients, maternal lactation needs are often overlooked.
Common causes for insufficient lactation support can include a lack of early communication about your wishes at the time of birth, staffing shortages and inadequate lactation support staff, and also inconsistent follow-up care after delivery.
One proposed solution is staff education. Many NICU nurses are not receiving lactation education. Facilities could use evidence-based studies and materials when training staff, therefore preparing their nursing staff to better support lactating mothers. A second proposed solution could be visual aid implementation. The visual aid you see in this slide is a universal sign for breastfeeding developed by Fiona M. Jardine, a registered nurse. An image like Jardine's could be placed on the baby's identification card or on the isolette. This could trigger the bedside nurse to ask more frequently and inquire intentionally about the mother's breastfeeding or lactation preferences. A third proposed solution is telelactation support. Use of technology available today makes telelactation support both a time and cost-saving option. Other benefits of telelactation include improved education and support and enhanced collaboration.
One specific short-term goal we came up with was that mothers would demonstrate how to correctly use the hospital-provided breast pump within 48 hours of admission. This may be simple, but they'd be able to measure it by observing if the mother was correctly using the breast pump and using the correct flange size. And then we came up with a few other ones that they'd be able to provide education to the mother within the first 24 hours in admission, and then documenting what educational materials were provided and then what was discussed would ensure that those goals were being met. One long-term goal we came up with was that mothers would successfully establish exclusive breastfeeding or pumping for 6 weeks after a NICU discharge. Obviously, the longer the better for NICU babies that they're able to get that exclusive breast milk, but they'd be able to follow up with assessments to ensure continued lactation and support post-discharge. So monitoring at home breastfeeding or pumping and providing that intervention at 3 months, 6 months, and longer if needed would then allow the mother to show understanding and commitment to breastfeeding or pumping after a NICU discharge. Unfortunately, there are a lot of barriers when it comes to providing lactation consulting in the NICU setting. Unfortunately, one of the main barriers is a lack of staff training. Not everyone is trained in providing lactation support or proper pumping or proper latching techniques, but to improve on the lactation consulting, the one important thing is actually improving staff training and providing consistent and ongoing lactation not only to NICU families, but first to the NICU members of the staff. And then another barrier is NICU staff not following up with families. A lot of times, a mother may only be approached about breastfeeding in the NICU once or twice during their entire stay. They may be there for months and they're expected to pump and provide milk, but it doesn't go much further than that. So telelactation programs can be one of the strategies used to provide consistent and better lactation support post-discharge. And another barrier is that there's limited resources. However, there are a ton of organizations that hospitals can partner with, like Baby Friendly USA and International Lactation Consultant Association, for them to receive resources and training so that they don't actually have to reinvent a bunch of new material. They can use the material from the partners like Baby Friendly USA to build upon what fits their hospital or facility best. One of the other barriers that we discovered was that it can be emotionally stressful for families. The NICU already is a very stressful place, but when a mother doesn't know how to properly provide for her baby, and one of the only ways she can while her baby's in the NICU, it's important to provide emotional support with lactation consulting. That way they can reduce anxiety and they can build confidence for new mothers. There's a variability in hospital policies is another barrier, and it can be important to like standardize protocols across NICU units. And then another barrier is actually pumping equipment or a physical barrier. So NICUs need to be equipped with sufficient pumping supplies, clean storage options for breast milk, just so they can help encourage mothers to provide their own milk for their NICU infants. In conclusion, intentional time, resources, staffing, and funding must be distributed to improve NICU infants' access to breast milk. Improving the education and access to lactation support will allow mothers to connect and provide for their NICU infant. The same emphasis on lactation education should be given to NICU families during their children's hospital stay as the general population. By helping the patient receive breast milk, this will also help the nursing population by decreasing infection, length of stays, and complications. It will also improve the caregiver's bond between the infant, and their satisfaction with the hospital will increase. Many facilities need to make major improvements to the lactation support that is offered, and those changes are available, affordable, and can be impactful. We hope you learned a lot about lactation support, and thank you for listening.